Here are two images of the kidney. In first image, you can see kidney anatomy in annotated image. Kidney is broadly divided into outer renal parenchyma and inner renal sinus. Renal sinus is composed of calyces, renal pelvis, fat, and vessels. In first image, this entire area is renal sinus. As renal sinus contains fat, it appears hyperechoic or white in ultrasound. Here in second image, this entire hyperechoic area is renal sinus. Outer to this white renal sinus, this entire structure represents renal parenchyma. Again, renal parenchyma is divided into outer renal cortex and inner renal medulla. Medulla is composed of 10 to 14 renal pyramids. These pyramids are separated from one another by invagination of renal cortex called renal columns. This relatively hypoechoic area represents the medullary pyramids. Adjacent to these renal pyramids, you can see hyperechoic renal columns. These are actually the invagination of outer cortex into medulla. Sometimes these columns are enlarged and these are called hypertrophied columns of Burton. These can be confused with renal mass. If you closely look at this image, unlike renal tumors, you can see the echogenicity of this mass is homogeneous and continuous with renal cortex. So this is renal column of Burton, not the renal mass. Normally in ultrasound, cortex appears slightly hyperechoic than medulla. You can see in this image, this outer slightly hyperechoic area is renal cortex. This inner slightly hypoechoic area is medullary pyramids. In chronic kidney disease, this corticomedullary differentiation is lost. In first image, you can see kidney in transverse plane. In transverse image, you can see central echogenic fat, middle hypoechoic medulla, and outer slightly hyperechoic cortex. Now let's talk about how to take kidney measurements. Longitudinal view, you can take length of the kidney. For that, we need to identify upper pole and lower pole of the kidney. And we measure this distance in centimeter. Normal length of kidney range from 10 to 14 centimeter in male and 9 to 13 centimeter in female. Similarly, we can measure anteroposterior thickness and width in transverse image. For measuring anteroposterior thickness, one caliper is placed at most anterior margin of the kidney and other is placed at most posterior margin of the kidney. We measure the distance in between these 2 points. Normal epithickness of the kidney is around 3 cm. Similarly, width of the kidney is measured in transverse image by putting one caliper at the medial aspect and other at the lateral aspect of the kidney. Normal width of the kidney is around 3 to 5 cm. Similarly, renal parenchymal thickness and the renal cortical thickness of the kidney can be measured. Parenchymal thickness can be measured from outer capsule to the base of the medullary pyramids. It means kidney tissue that lie outside the renal sinus is renal parenchyma. In this image, this hyperechoic line represents the renal capsule, and this hypoechoic structure is renal medullary pyramid. We have to measure the entire thickness of the kidney, only leaving central echogenic renal sinus. So this distance represents the renal parenchymal thickness of the kidney. Normal renal parenchymal thickness ranges from 15 to 20 mm. Alternatively, you can measure renal cortical thickness. Renal cortex is slightly hyperechoic area in between renal capsule and medullary pyramids. You can measure cortical thickness by putting one caliper at renal capsule and other at the outer margin of the medullary pyramids. Normal cortical thickness is around 6 mm.